Welcome to Implementing HIPAA Step by Step. In the next 15 minutes, we'll walk through the 5 HIPAA rules, the 10-step implementation process, and the practical safeguards every healthcare organization needs to protect patient data. You'll see how covered entities and business associates achieve and maintain compliance. This is a practical overview distilled from the full course. Let's get started. Let's start with the foundation. HIPAA establishes national standards for protecting sensitive patient health information. Understanding the 5 rules is essential before implementation. Before we explore the rules, here are the foundational concepts that every HIPAA implementation depends on. Protected health information, or PHI, is any individually identifiable health information created, received, maintained, or transmitted by a covered entity or business associate. This includes medical records, billing information, insurance details, and any data that can identify a patient and relates to their health condition, treatment, or payment. Electronic PHI, or ePHI, is protected health information in electronic form. It is subject to the security rule, which requires administrative, physical, and technical safeguards. With digital health records now standard, ePHI protection is the core technical challenge of HIPAA compliance. A covered entity is any health plan, healthcare clearinghouse, or healthcare provider that transmits health information electronically. These organizations are directly subject to HIPAA requirements and bear primary responsibility for patient data protection. A business associate is any person or organization that creates, receives, maintains, or transmits PHI on behalf of a covered entity. This includes IT vendors, billing companies, cloud providers, and consultants. Business associates must sign agreements and comply with HIPAA independently. HIPAA compliance is built on 5 interconnected rules. Each addresses a different aspect of patient data protection. The privacy rule controls how protected health information is used and disclosed. It establishes patient rights to access their records, request corrections, and receive an accounting of disclosures. It also requires organizations to apply the minimum necessary standard, using only the PHI needed for the specific purpose. The security rule requires administrative, physical, and technical safeguards to protect electronic PHI. Administrative safeguards include risk assessments and workforce training. Physical safeguards cover facility access and workstation security. Technical safeguards include access controls, encryption, and audit logs. The breach notification rule requires covered entities to notify affected individuals within 60 days of discovering a breach, report to the Department of Health and Human Services, and notify media outlets for breaches affecting more than 500 individuals in a state or jurisdiction. The Omnibus Rule extended HIPAA requirements directly to business associates, strengthened enforcement provisions, limited the use of PHI for marketing and fundraising, and expanded patient rights regarding electronic health records. The enforcement rule establishes investigation and penalty procedures. Civil penalties range from $100 to $1.9 million per violation category per year. Criminal penalties apply for willful neglect and can include imprisonment. Now let's move from theory to practice. The course breaks HIPAA implementation into 10 actionable steps covering assessment, privacy, security, breach notification, training, and ongoing compliance. Implementation begins with understanding requirements, conducting risk assessments, and implementing the privacy rule. Start by understanding HIPAA requirements in full. Review all 5 rules. Determine whether you are a covered entity or business associate. Identify all PHI flows, and map your obligations under each rule. Conduct a comprehensive risk assessment. Identify every location where PHI is created, received, stored, or transmitted. Evaluate threats and vulnerabilities, assess potential impact, and document findings to guide your safeguard decisions. Implement the privacy rule by designating a privacy officer, developing privacy policies and procedures, establishing consent and authorization processes, implementing the minimum necessary standard, and creating procedures for patient access requests. The core technical implementation covers the security rule safeguards and breach notification procedures. Step 4 implements the security rule. Deploy access controls with unique user IDs and role-based permissions, encrypt ePHI at rest, and in transit, enable audit logging for all PHI access, secure workstations and mobile devices, and establish a security incident response procedure. Step 5 establishes breach notification procedures. Implement breach detection systems. Create a risk assessment methodology to evaluate incidents. Prepare notification templates for individuals, HHS, and media, and document the entire response process with clear timelines. Step 6 covers training and awareness. Deliver annual security awareness training to all workforce members. Provide role-specific training for those handling PHI, run phishing simulations, and require documented policy acknowledgement from every employee. The final phase ensures HIPAA compliance is maintained continuously, not just achieved once. Step 7 establishes regular auditing and monitoring. Review PHI access logs, test security controls, conduct internal compliance audits, and track corrective actions. Auditing should be continuous, not just annual. Step 8 keeps policies current. Review and update privacy and security policies as regulations change, new technologies are adopted, and new threats emerge. Document all policy changes and communicate them to the workforce. Step 9 focuses on documentation and reporting. Maintain comprehensive records of risk assessments, policy approvals, training completion, incident responses, and audit findings. This documentation is your compliance evidence during investigations. Step 10 prepares for violations. Establish clear procedures for investigating potential violations, implementing corrective actions, documenting remediation, and cooperating with HHS during investigations. Understanding common violations helps organizations avoid the most frequent compliance failures. The most common HIPAA violations include failing to conduct or update risk assessments, lack of encryption on portable devices and email, insufficient access controls and audit logging, delayed or missing breach notifications, and inadequate business associate agreements. Best practices include conducting annual risk assessments with documented remediation plans, deploying end-to-end encryption for all ePHI, implementing role-based access with automatic session timeouts, maintaining a trained incident response team with tested notification workflows, and using standardized business associate agreement templates with regular compliance reviews. Let's close with the most important lessons from HIPAA implementation. First, HIPAA compliance requires implementing 5 interconnected rules. The privacy rule, security rule, breach notification rule, omnibus rule, and enforcement rule work together to protect patient data. Missing any one creates a significant compliance gap. Second, risk assessment is the foundation of everything. It drives every safeguard decision and must be conducted thoroughly and updated regularly. Most enforcement actions begin with inadequate risk assessments. Third, both covered entities and business associates are directly liable. The Omnibus Rule extended HIPAA requirements to business associates, making them independently responsible for compliance and subject to the same penalties. And fourth, compliance is continuous. Annual training, regular audits, policy updates, and ongoing monitoring are non-negotiable. HIPAA is not a one-time project. It is an ongoing program that must adapt as threats and regulations evolve. That wraps up our overview of HIPAA implementation. In the full Udemy course, you'll get detailed lessons on all 5 rules, the complete 10-step implementation process, privacy and security safeguards, breach notification procedures, and practical examples from Medicare Health Solutions. Use the course to build your compliance program with confidence. Thank you for watching. If this overview was useful, subscribe for more healthcare, compliance, and security content. See you in the course.